welcome to Coproduce Care's Chat for Care, and I'm absolutely delighted to have fantastic guests with us today. Many of you will know, many of you joined the Eventbrite and have actually submitted questions. I'm really grateful for those. And we're going to be speaking with our Minister for Care and Mental Health, and that's Gillian Keegan. And we've got some fantastic questions from yourselves, and we appreciate that so much. And also, I think as Coproduce Care, we have to appreciate the fact that we have a government minister who is going to talk directly to us and answer our questions about health and social care. So I'm not going to spend too much time on the intro. Sorry, we're a couple of minutes late, but we will make up for it. Only thing I would quickly ask you to do is we want to make sure that we're doing the right thing for you. If this is the type of thing that you want us to do, please do like and subscribe to our YouTube channel if you're watching us there. Share it through any of your channels to your colleagues working in health and social care, to people who draw from health and social care services, and please just engage in the debate. That we've got a government minister who deals with health and social care, and this is a great time for her to see some great examples of good care in the chat, anything that's working really well, anything that could be improved on. This is your time to really give some feedback. So we really appreciate if you just keep a happy, informative, supportive, constructive feedback even with your chat, but do get it going and make it vibrant. So a few bits of updates from us very quickly. So after we have a session with Gillian, we are then going to move on to a bit of a Q&A commentary discussion with our panel, and we have a fantastic set of panelists joining us. And as Coproduce Care, one of the things that we do like to do is to help people to engage with government consultations. They are the one way for government policymakers to really understand what is going on in the sector, for you as people with experience, lived experience, or people working in the sector, and to really help to inform how they are going to go forward with the policies, the laws, the guidance that will control a lot of how we operate. So one of the really important consultations that's live at the moment is that for the Mental Capacity Act. That is the Code of Practice, and that's live until the 7th of July. And as Coproduce Care, we have got a fantastic event that we've put together, and we'll let you know about it, where we will get barristers, lawyers around who are specialists in mental capacity to do a session on the consultation, and then we will do another webinar next to that where you'll be able to put together ideas of how the consultation should be responded to, and we will help to do a joint consultation response. So if you want to interact with that, then we'll put on our screen our email address, but also you can just go and Google us on Coproduce Care. And then also there is the Mental Health and Wellbeing Plan. It is a discussion paper and a call for evidence. So if you have some updates or anything that you think would be useful for policy makers to understand about mental health and wellbeing, then please do respond to that. Got till the 5th of July. Of course, it's not directly about social care as such, you could say, but I think it's absolutely relevant considering that a lot of us are dealing with mental health or mental ill health in one way or another. So a little bit of an intro really to our wonderful guest today. And as many of you will know, Gillian is the Minister for Health and Care, but also for mental health. So really useful to see any of the views that you might have on mental health, mental well-being. But also she's been working really hard on some other issues just before becoming a minister, and that was around working for APPG for adult social care, but also working as co-chair for APPG on women as well and work. So I think that dovetails brilliantly in what we can discuss around the workforce. And for anyone who doesn't know what an APPG is, it's an all-parliamentary party group that really looks at different issues, has different inquiries, and then they do respond to them as well and give a report. So without further ado, I will bring Gillian into the live stream. Welcome, Gillian. How
Thank you very much, Sophie, and thank you for inviting me.
That's okay. You're more than welcome. And thank you so much for taking part in this live stream. So we've got a lot of questions that we've had actually put in by people. One of the first themes I'm going to go straight into is workforce. And really, I want to draw a little bit on some of the work that you did with the APPG on social care. I know it's quite a while back. It's in 2019. But I just thought it was a really good report because it really looked at people who work in the sector. It gave a good representation of the different issues. It talked to people, it took that into account. And one of the things that it highlighted, this is the front page for anyone who's not seen it before, is one of the things that could really support people who work in social care. So in this section, it talks about, one of the main issues is because pay is low. Employers probably know the candidate they want, but it's really, really difficult to support people with the right pay. And also sort of skills for care, you will know as well, did a really interesting a bit of an infographic really in their latest report, and it looked at the change in the pay rate for care workers over a period of time. So back in 2012, 2013, care work, the median level of pay for care workers was actually just about above cleaners and domestics, dry cleaners, kitchen and catering assistants. But over that period of time, so going forwards to 2020, 2021, actually care workers' median pay has come quite a bit below all of those, most of those, and just slightly above dry cleaners and kitchen and catering assistants. So, I mean, a lot of people will comment on some of the issues, obviously, with pay and wages. And we actually, one of the first questions that we have, I think if we could pull that up from Yvonne, is how will the Minister and her colleagues sustain social care when we cannot recruit without considering the hourly rate of pay of our social care staff, which they currently receive? So I wondered if you could speak to that, but while you sort of prepare an answer to that, I wonder if we could play a clip from Lily from Carers at Home, and she talks a little bit about the levy and how that might be used, and you can sort of explain whether that would be appropriate. I don't know if we have that clip available.
So, number one, the first question is, the biggest issue facing the care industry right now is the exodus of care staff to sectors offering a better pay and conditions. Please confirm that the government will ring-fence the money raised by the health and social care levy so that care workers receive a pay increase that will encourage them to stay in the industry. At present, they are effectively taking a pay cut due to the increased NI.
Okay, so that's enough for me. Over to you, Gillian.
Are you ready for me to come in?
If you could, yes, on the issue of pay.
Yeah. Okay. Well, first of all, thank you for also pointing out that I was interested in this subject long before this ministerial role, and the reason I was because one of my best friends from school, and I left school a long time ago, over 35 years ago now. But one of my best friends from school, who's still one of my best friends, is worked in the care sector pretty much all of her adult life, and it was actually talking to her about it when I became an MP, and she was really making me see some of the struggles and difficulties. And actually at the time, I remember there were 122,000 vacancies. I think there's actually a bit less than that now, but it always seems to hover around the 100 to 110, 20,000, and it has done for years. And I think there's a number of factors there. The first is it's a a large workforce, 1.54 million people work in it, and it's a growing number because obviously the demographic shifts mean that there's more and more people who have need, and people are living a lot longer as well, which has also created a need. So that's one of the reasons why I looked at it and thought this is difficult to continue as it is continuing. However, this is also made much more difficult because unlike the NHS, these care workers, social care workers, are not employed by the public sector. They're employed by the private sector. In fact, they're employed by 18,000 private sector companies. And I've worked in the private sector most of my life, but, you know, they are independent of central government. However, of course, there is a relationship because local authorities obviously commission quite a bit of care, and that differs in different places. So what they pay also impacts, you know, the overall money that is in the system. So it's a very complex system, and it certainly isn't something that the government would set the pay and terms and conditions of this many private businesses. However, we do know that we need to make sure that the market is sustainable, and we need to move towards a fair cost of care. So we have actually put an additional 1.36 paying providers and have this cross-subsidy, which is very unfair. And actually, I've seen myself with my own grandmother who was paying, her and two other people were paying, and everybody else was getting a much lower rate that the council had put in place. So there's a lot that we need to do, and the local government finance settlement does actually provide extra money as well, an extra £3.7 billion to councils so that they can commission wisely. One of the things I think that's happened in this whole sector is people haven't really been focused on the most important thing, which is you don't have a care system without the caring workforce, and the caring workforce need to be paid fairly. They need to be paid for the hours that they're doing, and they need to obviously be invested in and trained and valued, etc. And that's one of the reasons we're very much focused on the social care reforms and the levy, which will go towards not paying extra per hour, because we don't do that. That's what the local providers, private businesses do. What we do is set the minimum wage, which has now gone up to £9.50, and the £9.50 and the minimum wage, actually we've said the minimum wage by 2024 for workers over 21 will be 2/3 of the median earnings, so that we have an ambitious minimum wage. And according to Skills for Care, about 20% or so of the workforce are on the minimum wage, which would lead you to believe that the others should be on more than the minimum wage. But this is be good to get some of those insights as well. But one thing that's clear is if you're an employer, you need to attract labour and you need to attract people. And normally you do that not just by pay. Pay is one factor, but your terms and conditions, how you're treated, how you're supported in your workplace is very, very important. And that's why the £500 million that we have got to invest is really to invest in the skills, to invest in the knowledge and skills framework, to make sure that people have a transferable passport that shows the skills they've got. There's a lot of training, retraining, and really there's a lot of waste the way that we go about the system today. So we need to professionalize, and we need to move towards at least we're talking about having a hub as well, where we can ensure that we know who the carers are and we can really professionalize the sector. But it will take some time to move towards that, and it isn't just as simple as us saying everybody has to be paid X above obviously what we do in terms of the minimum wage.
Very interesting. Thank you for that, and so much in there. We don't have time to unpick all of it, but I did want to come back on your comment about the fact that the government isn't dealing with pay and it is individual providers, and you did identify really helpfully that there is an obvious link there. But do you think that's something that the government should have some input? Obviously, we're very passionate in the APPG's report about pay, and obviously you are part of the Women in Work and how that has an impact on women's lives, or women's health, or women's mental health. It does come back down to really whether you can feed your family and keep a roof over your head. Do you feel that that's something that the government needs to work on? And what Lily was coming back to, I mean, she had a suggestion about the levy should be used actually rather than for what you said, but for pay, that would have a better impact on workers' situations.
It wouldn't. What you need to do is you need to put the foundations in place so that, I mean, obviously we have the minimum wage, which is what you would say is a response back to making sure that there is, a minimum of £9.50 per hour. But unless you put some of these reforms in place, it's not just the actual hourly pay, which, by the way, ranges massively across the country. I mean, 20% of people, according to Skills for Care, are on the minimum wage, others are above that, and there's a huge range. And as Julie's just said, the training in the system and the retraining is part of that. So unless we can fix the fundamentals, that would be difficult to do. However, we do need to make sure that councils are paying a fair cost of care, because that translates into as well the rates that they pay for both domiciliary care and also the rates they pay for a bed. Sandra's just asked about working towards a hub. What we're going to do is we plan to introduce a voluntary digital care workforce hub, which will help identify people in social care, those working in social care, and provide them with access to resources to help them in their careers. We want to see much more career progression as well, and also at a local level for careers to be able to progress within the health and care sector. And this will also include a skills passport, as I said, to provide staff with a permanent record of the training they've done and the development of that over their career, and also more opportunities to upskill and to get to higher levels, which ultimately is where you give women more supply and demand is ultimately what will also impact wages, which is going to impact this sector as well. As we started talking about, people will have to put in fair and market attractive wages, otherwise you can't attract people. And that's part of what we're trying to do now with putting more money into the system. This should have probably been done a long time ago when people have talked about it.
I'm just going to absolutely agree. Yeah. Can I just come back on the 500 million? Because that sounds like a fantastic amount and really generous. And I just, a comment, we had a live stream with some other commentators, including Jane Townsend from the UKHCA, and she gave her thoughts on the 500 million.
The real problem, Sophie, is that 500 million over 3 years works out at £111 per person per year. And the government talks about professionalising the workforce, whatever that means. I mean, can you find a single training course for that sort of money that's worth anything?
But I don't really need you to comment on that. I wanted to actually go back on the fair cost of care, because I remember reading through the white paper and thinking, what does the fair cost of care mean, and why is it not the actual cost of care?
Well, what is the actual cost of care? You've got two costs in many cases. You've got the one that the self-funders are paying, and you've got the ones that the commissioners, the councils and local authorities are paying. And what we know is it's unsustainable to have these two different costs for the same service. And in my nan's case, she was in a care home in Knowsley, in where I'm from, and there was only two of them. It's quite a deprived area, so there was only two of them self-funding, and she was only self-funding, by the way, because she had bought her council house under the right to buy, so that's why she had some cash. And they were paying a third more than Knowsley Council were paying for everybody else in there. So what we need to do is equalise these amounts so that people are paying. The fair cost of care is one set of consumers, not cross-subsidising another set of consumers. And what's happened is, because councils have purchasing power in many areas, quite a lot of areas, and in some areas they'll be the biggest buyer of beds. Because they have that purchasing power, they've been obviously using that to get a lower rate. And what the care providers have been doing is putting the rate up for everybody else, and that doesn't work. First of all, it's not fair, but secondly, when we try to introduce the charging caps and those, we need to make sure that everybody's metering at the same rate. So it's quite complex stuff, but the fair cost of care is one, same you know, sort of not standard, because you have different rooms and different things, but the same for whether you're a self-funder or whether you're being funded under your local authority.
The only thing I know people are going to be screaming at me, probably not in the chat so much, is that it's a lot of talk about care homes, and social care is just such a nuanced part. But what the one thing I wanted to just check on is that there seems to be, you talk a lot about care, local authorities and providers, and I wonder whether their behaviours are a reaction to the type of funding, basically, that they are provided with, and the way that they can operate, which ultimately comes from your type of positions, and whether you can push from your end to help, you know, look at pay and how that can be changed, look at conditions, and try and change those behaviours, which is a trickle down from the government.
Well, the national government's role in pay is to set the minimum pay, right? That's the minimum pay. And as I say, by 2024, that will be, for over 21-year-olds, that will be 2/3 of the median earnings. Now, of course, we're not ever in a situation, and neither should we be, where central government is setting pay and conditions for, you know, businesses all across the country. That wouldn't be something. I think in the 1970s, they used to have somebody who had that job, but that certainly wouldn't be a job that would be the right thing to have now. However, what we do need to make sure is that where we're the purchaser or via the local authorities, that those commissioning practices are fair and make sense, and they are sustainable. They ensure that the market is sustainable. After saying that, businesses also have to run their businesses, and they have to run them well. And I go out often. I've been out on domiciliary morning rounds with people. I've been out to understand more about the sector and actually some of the differences in the sector. And, you know, I've heard examples from people who say, you know, I don't get paid. I'm a domiciliary care worker. I don't get paid if my patient that I look after, or my person that I look after, is in hospital. And of course, flowing all that risk down to the individual is not good practice, because when you look at, you know, whether you'd have that, your hours potentially affected by something you can't control in all of those other professions that you listed, well, you wouldn't. And therefore, people make rational decisions. People will go, as you said, to where they can get the pay, and they want rewarding jobs as well, but also security is something that's very, very important. And another feature, whereas, you know, which is part of what we're trying to improve, is the risks that are in the system flowing down to the individuals. And in addition, in particular, the use of 0 hours contracts when they don't need to be there. I mean, 0 hours contracts are brilliant for flexibility, for seasonality, etc., but not for security. So if people want to ensure that they attract the workforce and they keep the workforce, then you have to pay well, you have to give people security, you have to be flexible, you have to invest in them, you have to value them, you have to train them. And many people will see, if they don't do that, they'll find it very difficult to run a service, because you can't run a service without your staff. You can't in almost any business, but in this business, you certainly can't.
Maybe that's your endorsement for the government to provide more money for providers to pay staff for, so they don't have to do 0 hour contracts. But no,
that's what we've just done.
A little bit.
That's what we've done. That is exactly what we've done. We've provided 1.36 billion to the Market Sustainability and Fair Cost of Funding, and 3.7 billion to councils in the local government finance settlement. So, you know, now nobody is ever going to say, you know what, I've got more money than I know what to do with. That's just the nature of these jobs. But there is additional funding going in. And if we could cut out some of the bad practice, which leads to a lot of waste and retraining and rehiring, etc., then I think that would also go a long way to improving the sector, which is why we're really trying to invest in these key pillars to ensure that it's much more stable and more professionalised workforce.
Is that those billions that you mentioned, they ring fence then for staff wages and for things like what you were saying with 0 hour contracts, or is that something that's going to be spread across health and social care?
I missed the beginning bit of that. You cut out.
So you mentioned about the 1 billion, I think, and some more money that's being provided. Is that ring fence for social care staff, or is that going to be spread across health and social care? Because I think a lot of the worries for people is that it gets held up by health, it gets held up by tech companies doing lots of techie stuff, and it actually the amount that filters through to care staff. And I do want to move on from care staff, sorry everyone, but just to be clear, just so people know, is that something that will be going to care staff? Can they expect those changes?
So the 1.36 billion is the Market Sustainability and Fair Cost of Care Fund. So that's given to councils so that when they're looking at the rates that they pay, they can take that into account so they can equalise between, you know, effectively having cross-subsidised rates. So that's there, and that obviously would feed through to providers. You know, there's many people that need to make sure that they do the right thing before it gets into the pay packet, obviously, of the individuals who are working in the sector. But this high you know, the competition for labour, there's 1.2 million vacancies across the country in pretty much every sector. So if you want to employ good people, you really have to make sure that you you know, you do value them. And then the second part of it is the local government finance settlement, which is how much they have, you know, in terms of spending on social care. That goes to local authorities depending on spend on social care. Obviously, health is the NHS. Now, where your question possibly is getting slightly mixed up or referring to is the levy, which is this extra 36 billion, which is going towards two things. One is reforming social care, so not paying necessarily for, you know, salaries or anything, because governments, you know, these are private individuals, private businesses, but for putting the right building blocks in place to make sure that we have a knowledge and skills framework, we have this hub. So it's investing in that, looking at technology. There's separate funds for technology as well. So there's different things that are going there into different parts of it. And then separate from that is the bulk of that money in the first 3 years is going to the catch up of the NHS. So of the about 36 billion or so that we'll raise, just over 30 billion of it is going into the electives. But that again that's not NHS pay. That's done separately as well. It's quite hard to explain because it's extremely complex, but NHS pay is done by an NHS pay review body, but of course the government.
Yeah, I just wasn't really talking about NHS pay. I was just the body that is the NHS, and how much is actually filtering down. But I should talk about other parts of social care because we have had a few questions. One of them is about unpaid carers, and I noticed actually this morning that we had an article came out, I think, in the Guardian. If we can bring that up, about unpaid carers. And before we move on from staff, we probably should put a nod to them. So unpaid UK carers 4.5% worse off as COVID and living erodes benefits value. And I think we've got a little bit of a quote from the piece there as well, which goes on to say that new research suggests that people who receive the carers allowance, which is given to unpaid carers to help with their costs, are facing a cut of £170 a year in real terms this year. And also further down, taking into account price rises, inflation, the carers in fact face a 4.5% real terms cut. And I know that we had a question about unpaid carers as well from Lynn D. Are you able to talk about unpaid carers? Because I think sometimes they are the forgotten part of the social care workforce that sometimes gets lost in all of this.
Well, very much so. And they're certainly not forgotten by me because my aunt is an unpaid carer for my uncle with dementia, and my sister-in-law is an unpaid carer as well for my nephew with learning disabilities. And unpaid carers are usually family carers. I think a large percentage are caring for somebody, a family member, and quite a lot as well are living with that family member. So I think the first thing to say is, in terms of unpaid carers, a massive thank you. I mean, obviously they do such a lot to take care of their family, their loved ones, and they do it obviously with good grace, but it is an incredibly difficult job and an incredibly difficult role. And one of the things in the social care reforms is to provide more services and support for unpaid carers. I was quite struck during the pandemic, a lot of, and I understand why this happened. Obviously, in the pandemic, there was lots of things that stopped, but some of those things that stopped were some of the support services, day services, respite breaks, and things like that, which are very important for many unpaid carers as well, to be able to also have some time for themselves, or to be able to be supported in doing what they need to do in their lives as well. So we're very much putting a focus on that to make sure that we have support for unpaid carers, because they do support obviously their family members, and do a lot of the work that if they weren't doing that, would be somebody else would have to do. So that's the first thing. In terms of the carers allowance, what there's different elements. Obviously, you've got the carers allowance, which has gone up, as you said, 3.1%. Inflation is higher than that at the moment, and we've no idea, because obviously we've gone from inflation being 0.25% to being 7% in a very short period of time. So it's highly volatile at the moment as everything recovers from the pandemic. However, that's not the whole entirety, because many people who also will be living with somebody who will also be getting benefits and support through the benefit system as well. So a lot of people are the person they're caring for will also be getting support as well, and additional support as per the assessments that the benefit systems make. But in terms of the actual allowance, that's the allowance that, as I say, was a 3.1% increase. And of course, if you look now at pretty much everything and you put it against a 7% or 8% inflation, then of course that looks at the moment like it's not keeping in step. But of course, as I say, the Chancellor has said all along, he's kind of watching the volatility of what's happening and seeing what where we're going to end up, because it isn't the usual inflationary pressures. It's a result of us rebuilding after the pandemic.
Okay, thank you so much. There's so many good comments, but I have to move on because we did have some people who were so kind enough to do some video questions for us. And I do know that some of them are quite specific, so you might not be able to directly respond to them, but I definitely want to honour the fact that they made an effort to bring a question to us. So even just so you could listen to it and hear it, and maybe take us away as something to consider. So maybe we can go to one of the first video questions, which I think is from Nicola Z.
Nicola Zielinski, Project Officer for ResCare. ResCare lobbied strongly for families of the severely learning impaired to be able to legally advocate for our families around the Mental Capacity Act. This was ignored in favour of the elderly focus, which has led to the disempowerment of families to obtain welfare deputyship through the Court of Protection. What do you plan to do to remedy this situation and make it easier for the families of the learning disabled?
Yeah. Well, the first thing is that we definitely want to make it easier for the family of the learning disabled. And as I said, I have a nephew with Down syndrome. So I very much feel this personally. The Ministry of Justice is responsible for any proposed changes to the Mental Capacity Act, which was in 2005. And that is an important piece of legislation which sets out how professionals should support and care for people who lack capacity. And the Department of Health and Social Care is responsible for how this is applied in a health and care context. So that's important to set out. And the Mental Capacity Act makes it clear that families, friends and others who take an interest in a person's welfare should be involved in a patient's care and treatment, and that is stated in several parts of the Code of Practice. If a person does not have the capacity to appoint someone as their lasting power of attorney, then somebody else can ask the Court of Protection to make a decision on the person's behalf, or can apply to the court to be appointed as the person's deputy. Whether someone's appointed as their attorney is a matter for the court and not for the government. And any decision that's made should only be made if this is in the person's best interest. So it's quite a complex piece of legislation, but hopefully that's helpful for Nicola.
Thank you. That was great. That was great. I don't know, obviously, whether she found that helpful, but I think I wasn't expecting such detailed response. So that's something for her to maybe take away or comment if she's watching live. I think we have another video as well that we wanted to bring.
My name is Maurice Collins. I am the father of a severely learning disabled daughter who sadly passed away a few months ago. I am very concerned that the choice of care is being removed from people with a learning disability and their families by sentences used by the CQC in their publications. This denigrates residential care in village communities and thereby threatens the lives of hundreds of residents and their families. Could the Minister examine this problem and have talks with the families that are under threat of closure of their residential placements to understand fully the issue? Thank you.
Well, thanks very much, Maurice, and I'm very sorry to hear about your daughter. We are focused on ensuring that all patients, including people with a learning disability and autistic people, receive safe and high quality and appropriate care. And actually, one of the things that many viewers will have probably seen is the focus on those people in inpatient settings. And there's been a lot of news reports and there's been a lot of investigative journalism actually looking at certain people who have been put in inpatient settings many miles away from their families and not getting the right care and support that they need. So that's why we're trying to ensure that we build a better community offer in the community with supported housing, with a care team to ensure that those people, particularly with learning disabilities, are looked after better in the community and don't have to be in an inpatient setting, either close by or even many cases miles away. And we do support the CQC's more robust approach to regulatory action and the NHS England's safe and wellbeing reviews, because it's really important to look at people who've been in a situation for quite a long time, to review the situation and to see if they're getting the support that they need. One of the things I want to avoid is that people are kind of, I think there was a report actually, out of sight, out of mind, where people are away and their cases aren't reviewed, whether they're getting the right treatment isn't reviewed, and also trying to make it better in terms of being closer to their family is something that it is a challenge, but that's the focus and that's the direction that we want to go in, to get better community support in for families in supported living settings.
Okay, great. Thank you. We did have another question, because you're talking about sort of mental health institutions and settings. And there was something in the chat. I'm so sorry, I can't bring it up, but someone did say that there are young people, children who are still being admitted with learning disabilities or autism. I think that's what the question was in the chat. And they just wanted to know, when is this going to be addressed? And I think we did have a direct question as well that was submitted about this. I don't know whether we can pull that up still or not. But I just wondered whether you have any words of support really for people whose children are still admitted. Here we are. There are young people still being placed and detained in adolescent and treatment units long after the government said that it would end this practice. What action will it take to ensure that they are not harmed by such detentions? So yes, that's the pre-submitted question. Thank you.
Yeah, and the government definitely wants to make sure, as I was talking about earlier, that wherever possible, people with a learning disability and autistic people of all ages are able to lead ordinary lives in the community, close to the family, with the right support to prevent a crisis and the right support around them. When there is admission to a mental health hospital is necessary, it has to have a therapeutic benefit. Care and treatment should be high quality, and there should be a treatment plan which effectively sort of focuses on somebody being treated and being able to be for the shortest time possible and being able to rejoin the community. So in the NHS long-term plan, as Tom quite rightly said, we are committed to reducing the number of people with a learning disability and autistic people who are inpatients in mental health hospitals by 50% by the end of March 2024, and we focus on that, and we are making some progress. But joint action is definitely essential to drive progress. That's why we're building the action plan for this, building the right support in the community. In addition to that, we're also proposing to reform the Mental Health Act, which will help reduce inappropriate detentions of people with a learning disability. So you can't be put into this situation just because you have a learning disability. And last year we also published our Mental Health Recovery Action Plan, which was also backed by additional monies as well. So there's quite a lot of work going on in this area, and of course the Mental Health Act review will also be a key pillar as well. But we're reviewing everybody in these settings, and we're making sure that they are in the right place and they have the right treatment plans, and that we're then building the right support in the community. It will take some time, but it's definitely something of a huge focus.
Okay, thank you for that. And we have our last video question from Anita regarding rehiring care staff. I wonder if we can play that.
Hi, I'm Anita Bennett, Chair of National Rest Care, and this is my daughter Isabel. She lives in a wonderful residential village community. Some of Isabel's highly qualified long-term care workers lost their jobs, with thousands of others, when providers followed the government vaccine mandate. This has increased pressures on every care home in the UK, yet NHS workers kept their jobs. My question is, now that the mandate is ending, please will you personally commit to new legislation to oblige companies to re-employ these much missed people?
Thank you very much. And I want to appreciate all the hard work you had.
Thank you.
I mean, that was just such a heartwarming video. I'm so glad we were able to show you that. But yes, have you got any response to Anita and her daughter?
Yeah, I mean, it's lovely to hear that Isabel's got a fantastic place. It sounds like she's in a wonderful community, and it's exactly what anybody who has a relative with Down syndrome or any learning disability wants. In terms of the specific point, obviously when we made the decision, it was a very difficult decision to require vaccination as a condition of deployment, and we really started that for those that were in the most vulnerable people, actually. So they were largely in care homes, and actually people with Down syndrome were also extremely vulnerable during the pandemic. And of course that was something we put in place, and then that was going to be extended. And what changed actually is we moved from Delta to Omicron, and actually the impact of the vaccination and also the severity of the disease changed over time. But those employers who dismissed people who were not vaccinated, and I will still say we would urge everybody to get vaccinated, because the people in care homes and people with learning disabilities, in particular Down syndrome, they are extremely vulnerable, and the outcomes are they're in a much in a more vulnerable state in many cases. So we would still urge everybody to get vaccinated. But those that complied with the law at the time, obviously, that was the law at the time. And then as it changed, as the virus changed. However, if a former staff member wishes to return to their former role, it's a decision for each individual employer to take. But I really would urge everybody to take the vaccine, particularly. It's a really important thing to get the booster and the vaccine, and to continue to get boosted to protect those people who are very, very vulnerable.
Just for very quickly, I know you have to go, but if it is possible, just somebody did put another question in, which we don't have time to play, about the grant that was provided for providers so that they could pay their staff for sick pay. And,
yeah.
Independent Sage did a a session last week about long COVID, and someone also put in a comment that lots of staff are having to go off because they are continually getting COVID, and that obviously affects their pay. So would the government consider reinstating the grant so that people could get full sick pay for when they are sick? I think that's not really just for COVID, that's in the long term. That would be very helpful.
Well, the vast majority of care workers, as I said, are employed by private sector providers, and they will determine the terms and conditions of their employment. However, we do expect that all care providers will, first of all, support good health and safety practice, and make sure that people stay away from the workplace if they are, have any infections. And really what we are doing is going back to living with COVID. Care homes have often, and any care service providers I've always had to deal with, sickness, infections, passing them on to vulnerable people, etc. So what we would expect is that people will go back to doing what they did before. Obviously, we provided a lot of support through COVID and a lot of additional monies for many, many, many different things. And I know that was much welcomed by the sector, but, we do need to go back to sort of living with COVID, but we also then need to put in place the real pillars, not short-term things, not just emergency procedures, but the real pillars that are going to make the workforce more valued, more invested in terms of skills and training, and also to make it a much more attractive place where people can have really rewarding careers. That's going to take us a while, but those are the most important things that we need to put in place. And what we won't be doing is pretending that we run all these businesses. We don't run these businesses, so we've got to make sure that we put the pillars and the foundations in place to support this really vital, really important industry. And as I say, with our care workers, they do the most amazing job, and they really I think they were much appreciated before the pandemic, but during the pandemic everyone saw just what a lifeline they are to the people that they look after, and we really do need to professionalize it, but it has to be done in a fair way, and we still will, we won't be setting terms and conditions apart from the minimum pay, but we will be building, as I say, the knowledge and skills framework and the ability for people to progress their career and progress up the earning ladder. That's something that we're very much focused on doing. I can't hear you at the moment, Sophie.
I can see myself on mute and I'm still talking. A huge thank you for joining us. We've run out of time. In fact, we've gone over a couple of minutes. So thank you for listening to the questions. I do really appreciate all your comments and all the comments in the chat. Please, everyone, do stay on for a commentary afterwards. I just would only comment that I do totally understand that the pillars are very important, but I know you know this, but the reality is that, of course, if providers haven't got the funding to pay people full sick pay, they can't pay them. And people are going off with COVID every other month sometimes, and they're having to be off work because they can't come in, and they have tests. Lots of places aren't testing it. So the practicalities of it are, like you said, in lots of other areas, very complex, and it's just undoable. And people are just going to go somewhere else, and they don't have to get tested, and they can pretty much go to work if they've got COVID anyway. So, but I know you know this anyway, and I'm not going to take up any airtime anymore. I appreciate you coming on, and I will let you go. And as you go, I'm just going to play one clip from the World Health Organization. We had an interview with them, and they have a report out called Health and Care, led by men, delivered by women, and it's really important what they said. We have a real opportunity within health and social care to actually be leaders as in a sector that really pays and rewards and respects women. It's a very feminized and gendered workforce, and this could be a really good opportunity to set the bar, not just for health and social care, but also for the rest of other sectors. So hopefully you'll take that away, and any of the other comments we didn't get to, but I'll play that off after we say goodbye to you. But thank you so much for joining.
Thank you, Sophie, and do be aware I am very much committed to ensure that this is a fantastic workplace for fantastic women and men. And, you know, I'm completely committed to it.
Thank you for that. So we will let you go, and just while we are doing the changeover for everybody, we'll play that short clip, and then we will introduce our panel. So everyone watching, please stay on for a discussion and more enlightening comments on health and social care. So thank you so much, Gillian.
Thank you.
Thing that's really interesting in this is that what we know is that women are delivering a lot of this health and care work. We know that these women are behind the health of our societies, our economies. But what we haven't really dug down to, and I think what's really important in there, is how important the health sector is for women. So it is one of the highest feminized sectors. Women participate in a higher rate in health than they do in the general labor market. So it's really important for women as well. And I think really getting into addressing and making sure that this sector has high quality jobs for women, jobs that really address the needs that women have, can be really transformative for labor markets for women in general. And how can health and care play a leadership role in that, as I think really what we're trying to push policymakers towards.
So, that was a very slick changeover. I wasn't expecting that. We're all there, no warning, boom. So thank you. I've got a fantastic set of panelists here. In fact, I'm just going to, can we put the overlay of the panelists before we actually hear from everyone? And if everyone can go on mute for the moment. So, like I said, we've got some wonderful people. I'm going to ask them to introduce themselves in a moment. But if everybody could just still engage with our material, still keep the chat going. We're going to bring up some other comments that people had and thoughts around this, but we really want to engage with you, and we'll bring up your comments and respond to them. So this is your time to have a discussion with us. We obviously couldn't have Gillian for this session as well. We would have loved to, but I think we were quite good to get her for as long as we did. So thank you for that overlay. So I think now I just want to hear from our wonderful panelists, really. But before we go into discussion, can I first go around and ask everybody to just introduce yourselves and just explain, any roles that you may have. Maybe you draw from health and social care as well as having a job somewhere else. But if you could just let everybody who's listening just explain, any roles that you may have. There we go, mute somebody. So yeah, if you could do that. I'm going to start off with Scott Watkin. Great, thank you. Can you just introduce yourself?
Yes, thank you. And thank you very much for inviting me. I'm Scott Watkin, and I'm Head of Engagement of Seeability. I lead a program for people with lived experience to have a voice within Seeability and externally. And also, I'm a person with a learning disability myself, and I have a child with autism.
Thank you so much. That was a great, succinct intro. So if everyone else could do similar. David Smallacombe, can I come to you next?
Yeah, I'm just unmuting myself. My mouse doesn't behave often with me. Yeah, David Smallacombe, Chief Exec for Care and Support West. Care and Support West, for those of you who don't know, is an umbrella body that represents and speaks on behalf of providers of all kinds of both regulated and unregulated care across the old, what we call the old Avon local authorities. So North Somerset, Bristol, South Gloss and Bath and North East Somerset. So yeah, that's what I do every day. That's why I get up every day to do. Thank you.
Great. Thank you, David. We've got a little bit of lag on your line, but I think everyone can hear you clearly, so that's absolutely fine. Can I come to Isaac Samuels next, please?
Hello, good afternoon, everybody. So my name is Isaac. So I'm somebody that has self-directed my own support for many years. I've had a personal health budget, and I've had, in most recent years, a direct payment. I'm really active within lots of organisations, trying to ensure that organisations really keep people at the heart of whatever they're doing, really interested in policy, and ensuring that people are involved in implementing, shaping and delivering policy, and and I'm a member of the National Co-Production Advisory Group.
Great, thank you so much for that, Isaac. Mark Tops.
Yes, good afternoon, everybody. I'm Mark. I am a Regional Support Manager for Essex Cares Limited, but also a Director for the National Association of Care and Support Workers. I'm a big advocate for social care, and you'll find me quite often advocating for the rights of frontline care workers, but also for the sector as a whole.
Great, thank you, Mark. Katie Clarke.
Hi, everybody. It's been great to see the chat. I know quite a few people who've been making comments, so that's really excellent. I'm a parent carer. I have 6 children and 2 have got impairments, and I support lots of families. I run Bringing Us Together, work for different organisations, and like Isaac very clearly said, it's about having people at the heart and making a difference. And actually, we've got the experts in the room because they're all the ones observing this and writing comments. So keep writing.
Exactly. And I really appreciate, I second that, Katie. I really appreciated the comments. Obviously, I couldn't ask everything and I couldn't, you know, I had to be balanced, but I really appreciate that your voices were there and heard. So last but not least, Belinda Schwehr.
Hello, my name's Belinda. I run a charity called CASCAIDR. We're unusual in that because we provide specialist public law legal advice in order to help people enforce their rights under the Care Act. We're not so much interested in changing the law, but just making sure that people get what Parliament intended that they get. So what Gillian Keegan had to say was obviously hugely relevant for us, because if the money isn't there for it, then what did Parliament think that they were doing?
Exactly, and I'm absolutely going to come to you to expand a little bit on some of the issues that you were raising in the chat on that, and why you were so passionate about putting those views forward. But I really want to come first. I haven't got any questions planned. I think we have some in the plan, but I kind of just want to go a bit off the piste on this, and I just want your immediate reaction on some of anything that you heard, anything in particular that kind of made you think, well, this is great, or this needs work, or I don't really understand. Just your reaction on any comment that you really want to kind of get across. And I really want to start with people who draw from health and social care as well. So can I speak? I'll go back to Scott, because obviously you've got caring responsibilities as well. Maybe you can come back on anything that was said just earlier. Thank you.
So unfortunately, I only just joined just a few minutes ago, but I believe that what I'd like to be seeing is actually we have a health and social care system that's fit for purpose. It's designed by the people who use health and social care, and actually it's really important that people's voices are heard. I think from what I'm seeing around for lots of people with lived experience at the moment, is that actually we're not always being able to get our voices heard, and we feel like we're being left behind, and it's really, really important that actually we do get our voices heard. And maybe it's time for a shift in the balance of power, and actually people live in our shoes a bit more. In terms of having a child with autism, it's always, and it's continuously always a struggle to make. We've had to fight for all the support that we get for our child, and for what our child needs, and actually it's around making sure that the SEND agenda, the special education needs agenda, actually works for people with disabilities and people with learning disabilities, so they're able to get the right care and support for their children.
I think that's some really wise words there, Scott. And I didn't get to ask this, but I really wanted to ask whether the government is working with DPOs, disabled people organisations. And I'm really gutted I didn't ask that, but I didn't want to go over time. But from your experience, you're obviously saying this needs to happen. So obviously you're not really feeling that there is enough representation from people who live with a disability who are actually impacting policy decisions. There's obviously other people who care for people who are in the mix with consultation, but not people like yourselves as much. Is that right?
Yeah, that's correct. I think back in 2009, when I was co-national director for learning disabilities, and being able to have somebody speaking within government, talking about the government policy valuing people now was really, really important, was really, really good, because you had people with lived experience, families, all at the centre, being able to tell civil servants, ministers, and tell them what for, really, and say what needs to change. And ever since, the they got rid of that those teams, and they had regional teams as well to input. They lost a lot of momentum, and what government decided to do was to decide to do their own thing, really. And it does feel like that we're not listened to, and providers also sometimes struggle with that as well, and not feeling that we can make lots of change. And I certainly know that, and Katie will talk about this, but families feel very frustrated by it.
Yeah, okay, there's a really important insight, Scott. I really appreciate that. I want to come to Isaac and then Katie, because I know from Isaac that you have tried as best as possible within your roles to interact with policymakers, as a lot of us do, but having managed your own staff to support you, do you feel that people are listening to you within the policy sphere? People like obviously you might not directly deal with the minister, but you might deal with people in Department of Health and Social Care. Do you feel like it is people actually listening and acting on it, or are they bringing people with lived experience to the table to tick a box, basically?
Yeah, I think all of the above. So first of all, it's always very disappointing to see how myself, Scott, and Katie turn up to these things. People with lived experience don't have a choice. We have to turn up and try to influence. We don't have a choice about this. This is about our lives. This is about the lives of people we love. The reality and the rhetoric gap are so big. So I will sit here and I'll listen to a minister talk, and I'll sit in the work that I do, and we'll talk about people being at the centre. Yet why is it so difficult to have the changes that we need to ensure people like myself, like Scott, like Katie and her daughter have really good care and support? So I think we've come a long way. Yes, I think we've got a hell of a long way to go. Where I live, there are policies and procedures in place that are fundamentally against the Care Act. So we've had legislation, we've got a new paper at keeping people at the heart of. And these are just policies. What people want are living experiences of good health and social care. I think we have an opportunity to influence. We try to influence. Would I say it's tokenistic? Sometimes, most of the time. Do people want to co-produce? No, they want to have good lives. Do we have to co-produce? Yes, because our relationship with systems is often adversarial. We have, large parts of social care deciding that they will ignore the Care Act, which is the law. These are the realities that play out in all of our lives. I always live in hope, because without hope, where would we be? We would be lost. And I think that for me, I want to be influencing. I want to make a difference. Is it painful? Is it difficult? Is it time consuming? Yes. But what choice do we have? I think together we need to really try to raise and change the narrative. There is a big reality and rhetoric gap. So the government will say one thing. So if you go onto any gov. website, we'll talk about the positive benefits of social care. Now, ask anybody here, talk about the positives. You know, most of our experiences are rooted in negative experiences, adversarial relationships, not embracing choice and control. Yet we're still here. It's a really difficult thing, isn't it? We turn up time and time again.
Yeah,
make a difference.
Absolutely. It's I can imagine it's exhausting. And I really love your point about actually we're not people who are with lived experience aren't just there really excited. They don't want, the reason of existence isn't just to be involved in co-production. And I think sometimes when you hear from policymakers, it's almost like you should be grateful for the fact that we are actually listening to you, rather than we actually want some tangible, substantive benefit from the engagement that we have. So that was some really important insights there. And I want to come to Katie next, and then maybe we'll go to Belinda and the others about the Care Act and the law and what was said. But what are your first thoughts about the interview we just had with Gillian, Katie?
Well, I think the thing that shocks me is that the Minister thinks that £9.50 is an adequate wage to pay people who are personal assistants and working in care. I mean, that it's shocking. It's no wonder that we're all finding it incredibly difficult to recruit, and that is not an okay wage. And the other day I Googled the word personal assistant, and I looked at some role descriptions of some jobs that are very similar to working alongside my daughter, jobs that require communication skills, interpersonal skills, time management skills, organizational skills, people able to multitask, attention to detail, prioritize, and getting to know the person, or in the case of some management or business, getting to know the manager and the business inside out. And those wages started between £17,000 and £25,000 a year. And then with experience up to £33,000 a year. It's not much different being a personal assistant to my daughter, plus there's the added responsibility and the personal care. And all our staff are highly skilled, and we actually pay more than £9.50, but we don't get a budget to pay more than £9.50. And I know that so many people are really, really struggling to recruit, and it's about lives. It's the value of paying people. It's the value of disabled people. If disabled people are valued, then the wages will go up. And again, I know that Anne wrote in the comments, Anne Pridmore, about the agencies at the moment are being paid twice as much as we're being paid. And yet we're also doing the management. On a personal level, we've got a team of 10 personal assistants and get no support to do the management and no extra funding. No extra funding to do training, no shadowing, no induction. So that's what really stood out for me, was the lousy £9.50 an hour.
Yeah, I mean, there was a lot where I was kind of biting my tongue and sometimes just wanting to cry, to be honest, because I was so exasperated by what was being said. But that was a really good point. And I think somebody put in the chat, I think that there was a bit of a typo, but what they were saying is that in order to get somebody to do housekeeping, you have to pay around £15 an hour, yet they are, care workers are professionalised, and I think they are already. We do have a profession. They do have to have certain training. It's just not an actual title or professionalised in some kind of way. But there's just a lack of understanding around or admission as to what is valued. And it goes back again to, I feel it personally, because I think it goes back to women's work and how people value the work that is done by women. And some people have even said, well, we just need to get more men involved, because if more men care, then the pay will just automatically go up. But that's not the way to look at it. And so I do definitely feel for your situation, and a lot of the response was, well, we've put up the national minimum wage and it's up to providers to figure it out and pay more. And I thought it was really interesting, the focus on a career and structure. Yet if you're not paying people, then why bother have a career if you're not going to get paid that much between a care worker and a senior care worker? None of it made sense to me. I often think these politicians know that they're not talking any sense. I want to come back to that and staffing, and I'll come to Mark and David on that subject. But before I do, can I just touch with Belinda on some of the legal issues and what she felt the responses, from the minister, were they adequate or not?
Well, I thought that Miss Keegan was one of the best prepared and smoothest and clued up sounding representatives of government that I've heard for about 15 years. But it still didn't convince me that there isn't a fundamental deceit from the very top to the bottom going on in adult social care. And as Isaac had said, the gap between the reality and the rhetoric is awe-inspiring. Some of the stuff she said about the fair cost exercise I thought was extraordinary, because of course the government needs to level up in terms of what it pays for the care costs cap policy introduction, because it's going to mean that the private subsidy ceases to exist. When Middle England needs to put their care needs through the local authority in order to start progressing to the 86,000, they are going to be made aware for the first time that local authorities end up paying less for care than private clients. And for the sake of their sons and daughters, the millennials who, have been hit by COVID, Middle England is bound to think, well, yes, we should get over ourselves and put our needs through social services. And that's going to mean that the private subsidy stops, so the government has to support the care sector unless it wishes it to disappear overnight. But the fair costs exercise is the government effectively nationalising or requisitioning care businesses by seeming to negotiate with them, but effectively telling them what they're going to be allowed to charge local authorities. And local authorities are not subject to the Competition Act, whereas providers are. And it seems to me to be the most disingenuous way of presenting what the government is doing. And I come back to the fact that if the sector decides not to sell services to a local government will have a duty to provide directly all over again, and we'll have to open up care homes and domiciliary care agencies, and we will have gone round in a 30-year cycle. And there is a madness at the heart of what is being said about this being a modern approach, to my mind.
Thank you for those reflections, Belinda. I'm going to move straight on to Mark Tops and then David, because I think on the back of those comments, there's some useful commentary. But Mark, I think you probably listened to most of that. Was there anything that's striking that came out to you in terms of the responses from the minister, positive or constructive, whichever? But before you do answer that, Mark, I'd really appreciate if everyone did just like this live stream wherever you are watching us. The team's worked really hard to put this together. It's quite a thing to have a minister on a live stream and make sure that everything runs smoothly. I was up until 4 o'clock this morning making sure everything was right. My team was working from 8 this morning, and we're a non-profit organisation, so I would really appreciate your likes on Facebook, on YouTube, wherever you are, and when you get a chance, just share with your colleagues or on Twitter or where else. So yes, over to you, Mark Tops, if you could come with some comments, please.
I think the biggest takeaway from me, a bit like Katie said, was around the hourly rate for care workers, but also the amount of times that she spoke about kind of tips and hints for retention, as if social care providers don't know how to retain their staff. I think there was a lot of talk, but I didn't feel like there would be much action from it or what she was saying. And I think there was a huge kind of grey area and kind of not enough talk about self-employed care workers. And I think what we're seeing in the sector is a lot of people leaving working for an organisation and moving into the self-employed market, which I think in itself is going to cause, a bit of a loophole and a cat hole of actually there's going to be a lot of people delivering regulated work that aren't actually regulated. And I know in my village here, there's a lot of people that go around to kind of my neighbours delivering care that aren't, they don't have a DBS, they're not vetted, you don't know who they are, but, it's growing around, in Essex, and I think that's probably across the country, and I think that's not really being spoken about. But I can understand why it's happening. You know, if you're only being paid £9.50 by your organisation, but you can charge somebody £15 and not have any of those kind of fees or anything, then, you know, I think that market is going to grow, and I think the government needs to pay attention to it.
I think that is a really good point, Mark. I mean, that is the risk, really, because there's a lot of talk, and if you look in the adult social care reform paper, they're banking on everything, or lots of everything, to be this career ladder. But at the end of the day, if you're being asked to do more training and you're asked to do more stuff on the care certificate and you're still not being paid, and a lot of people that I know do go work on the care certificate, you're supposed to get paid for a lot of work you do. A lot of it people do in their own spare time. And I think, well, can I just do this work for myself and not have to do any of this? So if there's going to be a push for people to professionalize themselves and not extra support and pay to recognize the extra professionalism that people have, then why wouldn't you just do it independently and get paid and not have to worry about it? And that's a huge risk because, like you say, the checks, the safety for everyone. So yeah, which may not be a bad thing. People might think that's a good thing, but very interesting point. David, can I get the perspective from you, but also with your hat on as a provider representative, on anything that you want to, one or two things you want to pick out to start off with?
Yeah, thank you, Sophie. Rather like Scott, I only logged in towards the end of what Gillian was talking about, but I was there when she was talking about professionalisation and also some elements of the pay. And everything everybody said around this virtual table, I certainly agree with. And one of the things that I wanted to make reference to is the incredible gap between the terms and conditions that you get if you work in the NHS and those that you get if you work in social care. And I think there is a bridge that would be helpful if central government and by dint of that local government were able to support the notion of marrying, if you like, the TNCs of on the health side to social care. That would inevitably and almost directly mean that people's pay would go up, which would equally directly mean that local authorities would need to pay more for the services they're commissioning. And by dint of that, you go straight back up the road to central government and look at the funding that's being provided for local authorities. And local authorities are still stuck in a place where they're not being, never mind not being provided with extra funding, they're actually needing to cut costs and find savings for a number of tens of millions of pounds as we sit here and speak over the next year. So I'm absolutely in agreement with all of that. I think the rhetoric of professionalizing and a career ladder and all of those kinds of things that the minister was talking about is just that. It's rhetoric. And I don't see any action flowing from that. And I think that the Belinda's point about the fair cost of care model that's being researched and looked at and so on and so forth. We've been doing some work. Our development director, Mick Albert, has been doing some work in that group where they've been working on it. And his point has been made, he's been made several points to them. One of which is it doesn't work to look at what care cost last year. What works is to look at what care is going to really cost going forward. And that's the model that should be being used to fund and to think about what the funding needs to be, both locally and centrally. Those were some of the things that jumped out to me when I started listening earlier, Sophie.
Thank you for that, David. One of the things that, I mean, you might have a view on this, is that kind of struck me was quite a frequent response to be, this isn't something that the government can really deal with in terms of paying conditions. This is something for local authorities. It's something that providers need to do. It's not really our place. It's not really what we deal with. this isn't what, you know, our remit, and really it felt a little bit like a passing of the buck to local authorities and to providers for, and obviously there will be individual instances where providers could do more on all of that, as well as local authorities. But I was quite surprised with how much there was pushing back towards that part of the system. And I just wanted to kind of gauge your opinion as to what extent is that really true and fair to do that, and to what extent do you think there could have been a bit more of a response to see, you know, what they would have liked to have done to support more in that area. And specifically, I was really interested with the grant situation. So somebody mentioned we might play the video in a sec. Long COVID is going to be quite a big thing for people, and somebody suggested that maybe the grant money that's given to providers to provide full sick pay for people could be reinstated. And you might have missed this, David, but what the minister was alluding to was the fact that really we need to go back to normal. You know, the grant money was short term, and it didn't feel like there was anything forthcoming. And I was thinking at the time, well, this isn't normal. Staff going off repeatedly with COVID for 5 days or whatever, or 10 days or longer, and then having basically occupational health issues, which they have to live with long term potentially, or having to care for people with long COVID. That isn't normal. So do we need to be considering that? But while you're thinking of a reply, David, and I will come around the panel on that and other issues, could we play the clip from Independent Sage talking about long COVID?
To hear Paula talking about some proper research into the health economic impacts of long COVID. I fear that we're really only just scratching the surface, because when you look at the care that the long COVID clinics are offering, that is only one part of the total burden of disease and illness. So they will then refer patients on for cardiology investigations, rheumatology investigations. They can often go around multiple different specialties, seeing different people. And I think when you look at the impact on those 1.7 million people, the 750,000 who've had symptoms for more than a year, their inability to work, they've got caring responsibilities, particularly people who've got children with long COVID having to give up work. You've got people on reduced hours, and the burden to the economy of providing that healthcare for chronic illness, sickness, plus the wider economic losses is going to be astronomical. And I know that the UK government has put 50 million in, but I think that pales into insignificance when you look at this as a rising burden.
Okay, so your thoughts on sort of the responsibility of providers and local authorities in this versus the government, David, and whether maybe we should have more of a grant for providers going forward.
Yeah, thanks, Sophie. It's a complete and utter nonsense to suggest that central government has no role to play in whether or not local authorities have the funding to purchase care at a level whereby providers can manage their own businesses and be sustainable on into the future. I don't quite know how they can dodge that one, to be honest with you, without being dishonest, because quite clearly on an annual basis, central government agrees the funding levels for each local authority. And if you think about what elected members need to do in each local authority, then they have to be looking to balance whether they fund this element or that element, or whether it's about roads, about transport, about adult social care. What we know already is that local authorities spend roughly 70% of their budget on social care. And I can't quite remember whether that's only adult social care or social care, but certainly 70% of their budget goes in that direction. And so it is a complete nonsense for the minister or anybody else in central government to suggest that the responsibility to make it all work well lies with local government and with providers. Providers are unable to deal with that in a way that maintains sustainability, and the whole kind of grant situation that is an annual event very clearly references that. I think your point about COVID and long COVID, I've heard quite a lot just recently, and we know that the infection numbers are kind of going up and down. But what we know more than that, of course, is that the vacancy rate is still extraordinarily high, both connected to people needing to be off and isolating, but also perhaps more importantly, and I've seen comments in the chat, people are moving on to other work where they can have different levels of pay. I saw in the chat somebody somewhere about, you know, being able to earn 15 or 16 pounds an hour to be a dog walker. Well, you know, if those kinds of things are in the mix, then quite clearly people are going to make judgments about where they go with that. And I think it's one of the things that care associations have been trying to emphasize with their commissioning authorities. And my one works with 4 different commissioning authorities, including, as you were saying earlier, and some of the comments in the boxes, Bristol. But yes, I think that it's very clearly, it's time for providers to stand up and shout. It's also time for people who are on the risk, you know, people who are with lived experience to continue shouting. But it's really time for local authorities to stand up and shout as well and challenge central government. That would be my view on that.
Belinda, local authorities, it's time for them to challenge the government. I feel like there's a conflict of interest it's almost biting the hand that feeds you. But
I think on a previous live stream, I was told by somebody from Surrey County Council that you have to be in the system and working with the system in order to achieve anything. And I just don't think that that is credible any longer. I think if there is a fundamental deceit in the sector, people have to have the guts to step up and step out, including in local authority senior management, and speak up to the party political system and the parliamentary versus cabinet system to make it all work a lot better. I think one of the fundamental problems is the fact that the local authority funding system comes from a different ministry than the Department of Health and Social Care. And I think that's why the DHSC is denuded of grown-up civil servants who know anything about the actual Care Act or how care is supposed to work. Most of them will probably have, you know, grandparents under 60 if they're age 21 and they're in the job for 2 years before they get moved on. So that's why I was impressed that Gillian Keegan seemed to know what she was talking about, but it still made me very angry that the leadership in adult social care is willing to say that they're rationing care and not properly discharging the Care Act, but not ever seemingly getting down and dirty with ministers and high up officers in the DHSC and the Ministry of Housing, Communities and Local Government, whatever it's called, and saying, why aren't you lot having a go at the Treasury? Because if it's the Treasury that is denying us the money through denying you the money, then effectively you are just running social care down, so that it doesn't exist, and so that we all have to do what Sajid Javid says disingenuously, which is to, you know, look to the family first.
Yeah.
And I think that the social care safety net is part of a civilized society.
Yeah.
And I actually think that we are past the tipping point, but that's from a legal perspective rather than a day-to-day perspective.
Thank you. And I can see Isaac nodding and Katie too. I want to bring you both in. I should also take some credit for her preparedness, because we do a plan for all our live streams and we did all the questions beforehand. They got them a week beforehand, and every time we did an update, so Sarah and her team had plenty of time to do lots of preparedness, so that may have helped towards it, Belinda. But Katie, you're already unmuted, so I'll come to you first.
Yeah, and one thing that she didn't speak of was the minister, but it has been brought up in the chat, is care charges. and this unacceptable way to take money from disabled people who are on benefits to pay for their care. And that is absolutely unacceptable. And during the pandemic, when all of us around the country received a brown envelope that increased with our increased charges. So in our case, my daughters went from £15 a week to 68, but we've heard so many other stories of care charges going up to 100 plus out of people's benefits. And then on top, we've got fuel cost increases, daily living cost increases. We've got people who are at their wits' end, who are exhausted, who don't have the right, who don't understand their rights, who don't understand about disability-related expenses, and who don't have the energy to complain. And this is such a dreadful way of taking from people to put back into social care.
Absolutely, it really, really is. And I don't know what you thought about her response on the unpaid carers as well. Isaac, can you come in?
So I think for me, the reality is if we want something different, we have to do something differently. And we have to truly recognise there is a cost to adult social care. And if you have local and national government having an argument about who's paying what, God forbid what happens at the bottom. People like me, Scott and Katie don't get what we need. If we want a society where people can have lives, connections and do things that are important to them, we need to sort out this issue around who's going to pay for the care that people need. Care will cost. We need a long-term solution to it. We need to ensure that people are involved in those conversations, not only involved in those conversations, but actually the care that is needed is provided. For far too many of us, it feels like each year comes around and there's another fight to happen, despite nothing really changing in our lives. I think it's really important to be mindful that we've had many conversations and ministers, governments come and go. We have not dealt with this issue about how are we going to provide sustainable solutions to the current care crisis? And I think we're in a crisis. It's really hard to not only find good care, it's really hard to keep them. We've talked about professionalisation, and I think it's really important to recognise that our workforce is already super professional. They don't need a care certificate to say that. They've got more knowledge and skills about supporting us on a daily basis. I do worry about if we start saying that we're going to professionalise all of these people in the care system, what about the other conditions that they will expect to come along with those, the over-professionalisation? The reality is that you can go and work in McDonald's and get more than you can providing care and support to someone to live their best lives. It's a great job. The people that support me, it's a great job for them. They make a massive difference to me, but it's really hard. It's hard to find the time to give them around their personal development. It's hard to find the time to actually support their own well-being. It's a real battle all the time, and I think we need to move away from this piecemeal of not dealing with social care. If we really genuinely want a social care fit for everybody, we have to pay for it, and we collectively have to pay for that. And Katie's so right. So many people we come across are being charged for their care when they cannot afford that. There is so much unmet need. It's unbelievable. We have local authorities deciding to ignore legislation. How is that possible? I mean, Belinda, we'll talk to this much more than I could ever talk to this.
Yeah.
But we've had a Care Act, we've had a white paper, we'll have something else in 2 years. The only thing I can say is that people like myself, Scott, and all of the people here will turn up time and time again because we have to get this right. This is about people's lives. This is about human rights. It's about life with purpose and meaning. These are human rights we're talking about. We're not talking about, we're talking about real people's lives who need support, who cannot live without support. So
I think it's such important. I'm going to come to you and Belinda, but I really want to hear from Scott and just your thoughts on this idea of someone's put in the chat around people being sent hundreds of miles away. And this did come up as a question as well. And I wondered what your thoughts are with people being sent far away for treatment, when I remember when the NHS long-term plan spoke about keeping things local. So there's promises being broken, I feel, for people, and whether that's something that you experience in your work, in your personal situation, Scott, and what your views on what the minister said about that.
So I used to be the co-chair of the Transforming Care Roundtable, where they were sending people with learning disabilities and autism to assessment and treatment units hundreds and hundreds of miles away. And at those meetings, I told them that you can't do this. And the thing that strikes me with all of those meetings and the long-term plan, the NHS say they're committed to reducing the numbers of people in these hospitals, in these places, and but lots of people are being abused in these places. We've seen Winterbourne View, we've seen Walton Hall, and we've seen many others, and it's been publicised on TV. And actually, do you know what? It's just damn well shocking. It's and we're human just like anybody else, and we have human rights. We should be able to have the right care at the right time and the right place. And actually we should have our community teams locally to being able to be better resourced and have the right resources, so people can have the treatment that they need locally. And if they are in crisis, they can have that done locally. But actually the NHS and DHSC don't see it like that, and they feel, and commissioners who hold the money just feel that they can they can send people away because they've got the money to do that. But there's nobody checking on these people. There's CQC, there's been loads of whistleblowing, and CQC have been in there, and still it takes a TV program to recognise the abuse and police investigations to happen. It's just simply shocking. We're not here to be abused. We're not aliens. We're human beings. And actually, the one thing I'm really sick of hearing is ministers in government saying, well, I get this, I understand this. And actually, they don't understand it. They don't get it. They just think they see social care as for elderly people and older people, but they don't see people like myself, Isaac, and the families who need who need care from a younger age, and also children. So I don't really know whether they understand and know what, like I said a few years ago, I don't know what planet these people live on, because they certainly don't live, the ministers certainly don't always live in the real world.
Yeah, 100%. Do you know what I'd love to see? A day when a minister is someone like you, someone who has lived through this, who understands it, because I feel that it's a very obvious script when you hear ministers talk, policymakers. They always, when they want to kick a situation or a question in the long grass, they usually start saying, well, my mother this, and my brother this, or my neighbour down the road that, and then they spend a couple of minutes talking about their personal situation. All very lovely. But what I want to hear from a minister is what you are tangibly, substantively going to do, and how you understand the perspective from people who are experiencing it and people at large who are in the system. And it's like a script that you find that they use. They chuck a few stats out, they talk about the personal situation, and then they may or may not answer the question. But I don't feel like there's any genuine answer to any of the stuff. And I feel that in what you're saying, Scott, and I agree with you, and been on so many of these, and it's the same sort of thing. And I do wonder, do they want to make any difference, or are they just trying to continue a relationship between the Treasury and keep their jobs or whatever, and then they move, they change, and it's really struggle. So I do value the thought that Belinda had and David said, that people do need to, from all aspects of social care, really do help them and make a difference. And there's polls, I think, on the 5th of May. People just need to use that. I think we need to use our democratic rights to make sure that we're heard. But I feel, Belinda, you wanted to come through with something else as well.
Yes, I wanted to say that something ties everything that everybody has been saying together here, which is the complete absence of accountability within the system. It is why commissioners of NHS hospital beds can get away with paying $13,000 a week for somebody being placed, I can hardly bear to call it that word, in a room that is a cell with a bare mattress on the floor and a hatch at knee level. It is the provider's feeling that nobody is going to make them accountable for a breach of human rights, and that the NHS Commissioner has got no other alternatives that enables them to just say they're doing the best they can. And it's that same thing that enables safeguarding bodies, the leads being local authorities, to just be captured by that whole culture of power and hierarchy, and end up saying, when those cases are referred to them, there's nothing we can do, everybody's just doing the best they can in very difficult circumstances. I am doing an Advocacy Plus contract at the moment to provide legal literacy for people who are stuck in psychiatric facilities. And even though I have been doing this for 20 years, it is still making me ashamed to be a lawyer in this country, that it is going on in 2022, that people have been stuck for want of treatment or care in facilities for 15 to 20 years and become institutionalized. So from my perspective, one of the most worrying things about the government's vision for the future of social care is that there is still going to be nothing other than the complaints system. The complaint system in health and social care is literally a postbox, to stretch out the pathway between somebody being dissatisfied and somebody having to get around to writing them an email, sort of apologizing, but not really changing anything. And the fact that there is no appeal tribunal for Care Act clients, and the fact that there is no real legal advice sector interested any longer, because it's too hard to make a living from doing legal aid judicial reviews that can create precedents that are of use to disabled people, has all fallen into this culture shift of lack of accountability. And I think we see it in central government. Nobody resigns any longer when something embarrassing happens. We see it in local government. People get promoted above the level of their own incompetence. And we see it in all walks of life, that it's not woke to be cross about things. Well, it seems to me that in health and social care, we have to be cross about it, but actually use the remedies that we have been given. And so that's why I still hold on to the idea that law matters for people. And we think we're going to make a difference when we sit in CTRs and tell people what laws they are actually breaking, and then get people referred to lawyers that we still have some faith in. I don't want people to think I run on testosterone and that it couldn't all be better if co-production was really valued. I think we would still have to pay for social care, and that's central government policy rather than local government policy that is the problem. But I just hope that social care will be an election issue when we finally get there, if any of us can be bothered ever to go and vote for anybody ever again.
Well, you said it, Belinda, as you often do. Thank you for that. I'm going to move to Mark on just to hear some of your views on what's been said, or to draw anything else. I suppose I feel that there's aspiration, obviously, that Isaac has mentioned with, where do we go next? We have very versed ministers who know how to answer direct questions, but we still don't feel that there's any tangible changes coming through. And things like the career progression, the 500 million over 3 years that was mentioned, that I put up that video to say, well, if you spread that out, what does that really mean? It does make you feel like, what more can we do? And I know, Mark, you in this space have done a lot, whether it's campaigning, as many of us have, campaigning, trying to get the workforce involved. You've got a podcast as well on YouTube, the Caring View, which people should also check out. But what more do you think we can do to really put forward some changes that are necessary? And I'll come to Mark and then to you, David, if that's okay.
Yeah, I think firstly, I agree with everything that everybody said tonight. And I think, firstly, touching on the career progression, I think there's so much emphasis on training and development and upskilling, but actually people that deliver care just want to deliver care. They're not worried about, I've got to do a level 2, I've got to do a level 3, I've got to do the care certificate. And I think there's so much emphasis on getting support workers in or carers in, doing the care certificate, when actually, whether I should say this or not, you can just log on to the Skills for Care website and download the certificate itself. And actually, how much value does that have for a workforce? I think there's a lot of comparison with the NHS, which has been spoken about tonight. But I think actually when you speak to NHS staff, they don't feel valued either. So I think we need to move away from comparing ourselves to the NHS. I think, we'd all love that appreciation that they have. But I think, we compare our pay to healthcare workers, but on average, they're only on £9. And I think what we all need to do is have a look at what the vision is for the future. Stop looking short term and actually focus on the long term. And I think that's for all of us here today. I think that's for local authorities, for government, for the CQC, because I think we all put in plans into place that only cover kind of the next rolling year. And by the time they're carried out, we're already on top of that date. And I think we're always chasing our tail. So I think, Gillian Keegan talking about actually £9.50 for care workers, actually what we should be doing is actually saying, well, actually, we know that McDonald's is paying, £11 an hour. We know Amazon are paying whatever, and all these other providers, and Sainsbury's pay £13 an hour where I am. Actually, we need to be setting a benchmark for, not now, but for further down the line. I think coming back to, not having the grants and the budgets to pay staff to go on sick leave, I think what we're actually seeing is providers now saying, well, actually, we've got COVID in the home, in the care home, you can come to work. And actually, it's just putting people at risk and more at risk. But I think equally, we've got care staff that are worried about how they're going to pay their bills. You've got fuel prices, increasing, taxes increasing. Actually, I think we're just leading to a big road of kind of burning out the staff that we've got, not valuing the workforce that we've got. And we all sit and talk about retention. But, I think when we have government and ministers that don't really tackle the issue head on, it's all kind of leading into this dark black hole that we're not going to get our way out of, I don't think.
Thank you for that, Mark. David, you wanted to come in?
Yeah, just a couple of things. First up, I'm not the most brilliant person on IT. Somebody asked for my email address and I don't know how to put it in. I'm just saying that. I just wanted to say a couple of other things though. The bit about the base rate of pay, and what we've been saying at Care and Support West is that frontline workers should be starting at £15 or £16 an hour, full stop. That's what we've been saying. That's what we've said to all the commissioning authorities. And what we've said to the commissioning authorities in our cost of care reports just in this last year have been that in terms of uplift, it needed to be at least 15 to 20%. And what we've been offered across the piece is anywhere between 4 and 6%. So I just wanted to put that in terms of what the reality is in terms of where funding is going. And the other thing I wanted just to put on the table, because I don't think we necessarily have paid enough attention to this, is that coming down the track, or already here in some ways, the integrated care systems. Each local authority, for example, across the Bath, across the Bristol, North Somerset and South Gloucester authorities, they've set up 6 integrated care partnerships, only one of which has social care sitting on it. And one of the things we've been pushing for is that model, which is incredibly health-led, and so most of the integrated care partnerships have only got health-related people sitting on them, and the way providers are represented according to the integrated care partnerships is because local authorities are sitting on them. That is also a nonsense. Providers need to be sitting on these integrated care partnerships. And I think it's another stepping up and shouting out that everybody needs to do towards local authorities, towards the CCGs, which won't exist allegedly after July 31st. Well, we'll wait and see. But the integrated care systems, in my view, are yet another model whereby social care, adult social care in particular, will find itself back into the long grass. I don't know what Belinda makes of all of that, but I think that that's a real issue coming down the track. And I just wanted to add that to the table in terms of what we should be shouting about.
And thank you, absolutely. Can you just give us a quick 30 seconds on integrated care partnerships, just in case for anyone who doesn't know what they are and why they're important?
Is that me or Belinda?
David, are you okay to do that? Because you're working with them.
Yeah, okay. So the notion is that there will be that the integrated care partnerships will be a place-based, that is to say, focused on the geographical area that it covers, and that the important key players should each be sitting around that table in order to make judgments and decisions about how care should develop, how processes should be put in place, how commissioning could and should happen, and how all of those things happen. And then there's an overarching body across that called the integrated care systems, to which the integrated care partnerships will report. It's, in my view, I think it's a nightmare waiting to happen, and that social care will find itself even further into the long grass. But Belinda may have got some comments to make that are perhaps a little more detailed than I've done, and perhaps a bit more measured.
Before I come to Belinda, I'm just concentrating on time as well. I just wanted to say that I'm sure Katie maybe and Scott might have some ideas on this, but these integrated care partnerships, how much are they involving people with lived experiences and families as well? I think your point, obviously you represent providers, David, is extremely valid, but they also should be on that panel and with the discussions. But I will come to Katie and Scott for that in a minute. But can I just go to you, Belinda, and then we'll go from there.
Thanks. I just thought I'd read out a quote from Camilla Cavendish. Baroness Cavendish was asked by Matt Hancock, I think, to think about integration. And she said this: the NHS should not be given greater control of social care because the NHS is hierarchical, centralised and not person-centred. And social care is more innovative, more responsive and human. The NHS's role should be limited rather than expanded because it is still struggling to join up even primary and secondary care. Joint commissioning by the NHS and councils, she thought, could effectively lead to an NHS takeover of adult social care by the back door, with the concomitant danger that the transactional, less person-centred approach of the NHS moves into social care, further weakening reablement and personalisation. So, I think it's a nightmare waiting to happen as well. Okay. But it is happening. It is happening.
Thank you for that, Belinda. And I just wanted to, Mark has put in our chat box, I dread to think how people with lived experience get onto ICSs. It's hard enough as a provider. I don't know whether, Katie, you've had an experience of this or thought around this at all?
Well, just listening to Belinda and David, it's going over my head. It just feels like more jargon, feels like yet another program that in 10 years' time they'll change the wording and it'll be something else. And locally, we've got an accessible Calderdale project, and we haven't been involved in any of the ICS, but even understanding it at local level and at people with lived experience level. David was trying to explain it very well, but it's really complicated. And the more complicated it is, the less we'll be able to get involved in it.
Thank you. I just think it's really telling. That's maybe something that we should be asking for when we have discussions with our local authorities and we do get involved with ICSs is, who are your representative organisations for people with lived experience? Why are they not at the table, and can they be? Scott and then Isaac on this point, please.
So I've had no input into integrated care partnerships at all. When I originally first saw this, and I thought to myself, are we going backwards? Is this like going back to primary care trusts when we had PCTs and everybody came together at Learning Disability Partnership Boards? Because actually it does feel like that it's made for professionals, this, and it isn't made for us as people with lived experience. We talk about co-production, and all our care and all our support should be co-produced, and everything we do should be, including our work, should be co-produced. But actually, in reality, I don't think the integrated care partnerships are co-produced, and I don't think they have people with lived experience on it.
Okay, that's really insightful. I noticed a comment from Essex, I'll bring it up again. Essex Care Support says there is one which they believe has some good, it would be co-production would be really good if you can name them, so we can just signpost other people, but if you can't, that's absolutely fine. Isaac, your thoughts on this one, and then I think we will come to closing comments. So yes.
So on paper, integrated care partnerships look like they will be a very useful thing for those of us that do not, you can't cut us up into health and social care. My local one isn't really co-producing. I am yet to see, I've heard of one good example of co-production, which is Suffolk. I think that we need to be co-producing. I think that health and social care needs to come together to support people's needs more holistically. I do worry it's a bit late in the day to kind of start including those voices. It's a shame because actually you can't really do any of this without the likes of Scott, Katie, myself. Everybody here is so able and willing to be part of that conversation of change. Yeah.
Thank you for that. I really appreciate those comments, and I think it goes to all of us. You know, sometimes we need to be each other's allies as well, and allies for other people. I think with this great panel has got a cross section of people with different interests and so on. And so when we are in these meetings, to say, you know, who do we have around the table, and do we have the right people to make a difference in our local areas? I think that's really useful. And you know, I go back to what I know and learn about DPOs, and it would be good to have a disabled persons organisation in each area that is added onto these ICSs as a matter of course. As a starting point, it's not asking for much, but how much do people want to interact with people like that? I don't know, but it's really been an engaging conversation, and I do just want to allow everyone to do any last 30 seconds of kind of closing comments or to shout out your organisations. We will put all of your organisations' details in the description of this live stream, and do please engage with all of our speakers. They're all doing fantastic things in different ways, whether it's supporting them through shouting out about them on social media or sponsoring them or whatever. But Mark, you've been quiet for a while. I don't like it. Can I come back to you?
Closing comments. I think tonight's been really good, or this afternoon. I think we definitely need to do more kind of shouting out and kind of beating of the drum to kind of get our voices heard. I definitely think that, you know, more partnership working. But when I talk about partnership work, and I think, you know, involving people that have lived experience, but making sure that they're actually part of that conversation and bringing them to the table. I think so often it seems to have become the hot topic at the moment, and it shouldn't be like that. And I think sometimes events and organisations are inviting people just to say that they've got somebody with a lived experience, but actually making sure that that voice is the one that's being heard and that they're there for the right reasons, not just to tick a box. Yeah, they're my closing words.
Thank you. Some great closing words. David, have you got any closing words for us?
Yeah, just I think there's a really nice trio that could be promoted from the back of this. And I think the trio is this: people with lived experience, providers themselves, and care associations. And I think the three could be a really powerful voice to be holding people to account and moving to get better services in the right place at the right time.
Great, thank you. And I think sometimes when people automatically hear that trio, did you say, they might think, well, they've got very different interests potentially, and they might not come together on certain issues. But I think a lot of the times we can often see the differences that we have within different groups and focus on that. And maybe we just need to see where we are roughly on the same page with certain things and come together on that front. So really helpful. Belinda, can I come to you for any lasting comments?
One of the things that Gillian Keegan didn't get to speak about was the advice and information proposals in the white paper. And there's a plan, I think, on the part of government to spend £5 million on making sure there's a government-controlled website that tells people about the way social services works in this country. And there's also some interest in providing a pilot for what is called personalized advice. Now, of course, I believe in advice and information to the absolute core of my being, but the local government association has said that £5 million for a central government website that won't do anything more than repeat the government guidance about how the Care Act is supposed to work is a complete waste of money when local authorities haven't been able to manage their own advice and information duties, and I would say, and have no interest in doing. Because the better the advice and information is, the more people want more social services. So I would just be leaving this panel with the thought that the Citizens Advice Bureaus need to teach people how to self-advocate using law, as well as arguing for co-production.
Great, thank you for that. Isaac, I don't think I've come to you yet.
Sure. So I obviously will talk about co-production, but I think many people here will talk about co-production. So I'd invite people to think about beneath every policy, every choice and decision we make, there's a human being that has a right to an independent life. There are carers that are caring, there are people needing support, and we need to think about the people that really need good care and support. We need a social care fit for everybody's needs, and we need to stop having these arguments over who's paying for what and really enable people to live good lives where they have purpose and meaning. And the only way that I can see us getting there is a long-term funding solution that sees people as part of that solution, that are central to driving whatever needs to happen locally, nationally.
Absolutely. I mean, there's just some fantastic points there. And I think when you are listening to ministers do throw out these numbers of money that is being provided, and what I try to do in a kind of a very neutral way is to dig beneath what the money is being used for, because when you actually see who's getting it, they may be answering a question about staffing or answering a question about lived experience, but the money doesn't actually go to those people, those individuals. It goes to tech companies for doing something, or it goes to consultants for telling us what a care worker is. And I've been in those meetings, and they're paying a lot of money to tell us that the grass is green. So it's quite important to see where that money is going and where we can challenge where that's going. Don't just take what you hear on the regular press about certain things. So some really helpful comments. Thank you so much, Isaac. And Katie, can I come to you next?
Yes. Yeah, thanks, Isaac. Because similar to you, we need to start talking about people, not labels, about having a good life, about successes, what's being achieved by disabled people and family members, and what's been achieved thanks to great support. We need to make it about the stories, about, like Scott said, about human beings and the humanity side. We need to talk about brothers, sisters, disabled people who are parents, aunts, their uncles, and about grandparents. We need to talk about real people with real lives. And then just one last thing for me as well is we need to prevent the admission, any further admission of young disabled people who are autistic and with learning disabilities into assessment treatment units. And we need to start that from early intervention, from better support in schools, better support for SEND children, good advocacy, and hopefully the key worker scheme that NHS England are funding, hopefully that will make some difference as well.
Thank you so much, Katie. Again, some fantastic points. And I absolutely do agree. I mean, we talk so little about humans. We talk being a human, being a person. We talk so little about lives. Well, we might, but I feel like in these high-level conversations, it just comes down to systems and money. And of course, it is really important to change the dialogue on that. So yeah, some really, really useful conversations, points on that. And then can I just move, last but not least, Scott?
Thank you very much. And I'll keep my points really quick because I know it's getting into the evening. So my first point is we're not a number. We're human beings, and we shouldn't be treated like a number. My second point is we need to keep having that voice, and we need to be shouting louder and working alongside our families to make sure that our voice is heard. And my third point is to all those professionals out there that actually you need to work with us, not against us, and we need to make sure that we have good paid staff and paid appropriately and not paid less, because actually people with learning disabilities and autism have a right to a good life and deserve a right to a good life just like anybody else. Thank you.
Thank you. That was a most fantastic point to end on, and I really couldn't have scripted it better myself, to be honest. I really appreciate you supporting us in giving comments. I think it's so important. We don't have enough of this, I think, in our regular media, to have some real commentary from people after we hear from ministers, after we hear from the government, to really put some context around it. And we've just been so fortunate and so blessed and so lucky to have a fantastic panel to follow the minister. So thank you so much for all your support, and I will let you have your evening back. And it's just really to encourage people, if you're thinking you enjoyed this, your clap to all the panelists and to the work we've done today would be a thumbs up on whichever medium you are watching us. And I say that not because we get paid for it, but because it just means, I think, with the algorithms, that more people will be able to hear these fantastic panelists across social care. And it will come up on more people's feeds. And of course, if you really enjoyed it, just copy and paste the link where you're watching us into an email to your colleagues on your social media or websites, just to spread the word, because I think we've had some really important contributions from today. So thank you so much to everyone who's been on the panel. Thank you to everyone who's put forward your questions, video questions, phoning us, letting us know what you think. Also, the chat has been fantastic. I've really appreciated that. So I'll say goodbye to our panel, and I'll just say a couple of things. So thank you all, everybody. Take care.
Thank you, Sophie and team.
Oh, thank you. So just to follow up on a few things, if you're listening to us on YouTube, you can subscribe to our YouTube channel, because we will be doing more of these. The next one is to look at the Mental Capacity Act. Obviously, if you want to hear more of this kind of stuff, you want us to do something different, and then if you could just subscribe to our mailing list. We try to send something out on a regular basis so that people can find out what we're doing, and you can just email us on hi@Coproduce Care, visit our website, and share as much as you can, so we can get more of this kind of stuff out to people who need to hear it. So I think I'm going to stop talking now and let you all have your evening. It's been a longer than usual session, but we really appreciate your participation. So have a lovely evening, everybody, and goodbye from Coproduce Care. Take care, everyone.